When you have these patients of abdominal pains at your hand and you want to know what is the etiological factor towards this particular condition of abdominal pain, there is these three major classifications that you got to have and that you got to basically keep in your mind. First of all, there are just the mild causes that can be present in a particular patient. And then there are the moderate causes for which the patient needs to be hospitalized, and there is some kind of particular treatment that you have to run for these particular causative factors. And then thirdly, we have the life-threatening causative factors. So identifying the life-threatening causes is the mainstay for you as a family physician. You should be well versed with the different kind of conditions. For instance, we have the AAA, that is the abdominal aortic aneurysms, that you have to keep in mind, and you have to be well versed and you have to rule out this condition first of all. For instance, we had Blake, who was an 8-year-old boy, and he presented to you, and his mother was worried about his condition of the abdominal pain, which occurred from time to time. And he seemed to be a normal boy who was gaining weight according to the age. His all other parameters were quite normal for his age. So that was basically suggestive again of the fact that he's not suffering from any kind of life-threatening condition or any kind of a tumorous condition. But still, we'd be ruling out all of the life-threatening conditions for this particular child. Now, to have a differential diagnosis for Blake, we must keep in mind that when you're looking at the abdomen of this particular patient, how would you examine the abdomen of this particular patient? And even the causative factors are related to the development of abdominal pain in a particular region of the abdomen. So as I told earlier, that the site of the abdominal pain is very important to because it is basically suggestive of the fact that which organ is involved for the development of the abdominal pain. Now, basically, it can be even a localized cause, and it can be a mid-epigastric pain. So when we divide abdomen into 9 quadrants, we have the epigastrium, and then we have the lower quadrants, particularly the right lower quadrant and the left lower quadrant, are the particular and the major sites for the development of the abdominal pain. And we'd be looking at how the site of the abdominal pain is related to the causative factors that are found in the abdomen. For instance, if the pain arises in the mid-epigastric region, it can be due to dyspepsia. So it can be just due to indigestion. Dyspepsia is basically a terminology which is used for the indigestion. So in that case, which is mostly the case for children, what you have to do is you have to educate the mother of the child or the caretaker of the child regarding the kind of the food he's taking, and even you can add up a lot of fiber in his diet, and that can be quite proactive in the removal of the abdominal pain in that particular patient. So educating the child's mother would be the highlight over here, and obviously, but we have to be first of all quite sure that we're dealing with dyspepsia in this particular case. Then we have GERD, that is the gastroesophageal reflux disease. It's one of the conditions that usually arises in the children, particularly in children who are hyperactive, and when they take something, when they take even small amounts of food, and that is followed by vigorous physical activity, that can basically lead to sometimes this condition of GERD in the patients. Then we have the patients who are basically suffering from pancreatitis. Now, pancreatitis is again a life-threatening condition, and we have to rule that out at first most hand. And this is very important. You have to run down the test. You have to basically relate to the serum amylase levels in this particular patient. And if they're elevated, that is basically referring to the fact that he's suffering from a condition of pancreatitis. So this is something that you have to look for. Again, when you relate to the fact, or when you go back to the fact, even the benign causes, they can arise in the mid-epigastric region, and even the life-threatening causes are present in the mid-epigastric region. So you have to look out for the life-threatening conditions, first of all. Then you have the pelvic inflammatory diseases that can even be suggestive of the particular abdominal conditions. Now, the right upper quadrant. It's again very important that you look for the particular factors that are basically contributing towards the abdominal pain in the right upper quadrant. Now, we have to basically relate to the fact that what kind of organs that are present in that particular region, or even somewhat related neighboring regions. It can be the gallbladder that is present over there. It can be obviously the cholecystitis. It can be the cholelithiasis alone. Particularly when I talk about them, cholelithiasis is basically when just the stones are present in the gallbladder. And when they get infected, or when they basically obstruct the pathway for the bile to come off the gallbladder, that can even cause a backflow pressure on the gallbladder and result in cholecystitis in the patient. And again, it would be an emergency condition in the patient, and you have to look for the fact that whether the patient is suffering from this kind of a condition or not, because cholecystitis would, in that particular case, the patient would also be having fever. There would be the other factors. For instance, there would be a raised ESR also associated with the gallbladder diseases in the child. Then we can have hepatitis. So if it is an infection of the liver, it can even present to you with the abdominal pain. It would be a dull aching pain that would be present, and would be again a generalized pain. Hepatomegaly is one of the conditions that can arise in the children particularly, and it can even present to you with the abdominal pain in the right upper quadrant. Now, moving on, we have the abdominal pain, which is present in the right lower quadrant. Now, when we look at the patients who are suffering from the pain in the right lower quadrant, we know that the structures that are present over there, the major structures, one of them is the appendix. It can get infected, and that would result in a case of appendicitis that can occur for such patients. So we have to rule that out, and obviously the white cell count would be raised, and it's not just an isolated raised white cell count for the patient. You have to look for an ultrasonography as well, which is also just suggestive of appendicitis in the patient. So even for the children, as we just studied the case study of Blake, and we went through the fact that he was also suffering from abdominal pain, and time to time it can be even suggestive of appendicitis, and we can be suspicious of the fact that Blake might be suffering from a recurrent appendicitis. So we have to look for that, and we have to rule out that cause. But we looked at the LFTs, the RFTs, and the complete CBC count that he had, and it went all normal for Blake. So one of the things that we can do as a family physician, that an ultrasonography can be carried out for Blake just to rule out the appendicitis. Then Crohn's disease, or even ulcerative colitis, they are a kind of an inflammatory conditions that can arise in children specifically. And then even the patient would be suffering from abdominal pain, and obviously these patients suffer from a lot of other symptomatologies as well. So there would be a history of recurrent attacks of diarrhea, and that is again suggestive of the fact that he or she might be suffering from Crohn's disease. Obviously, you would be running down the blood test to rule out this condition. Then obviously we have the gynecological related diseases that can occur specifically in female patients. So you'd be ruling that out as well. Because sometimes the pelvic organs, the diseases or the inflammatory conditions, the tumorous conditions, either benign or malignant in their origin, or even a generalized pelvic infection can even present to you as a pain in one of the quadrants, specifically in the lower quadrants. Either it can be the right, or even it can be the left lower quadrant. Now, Meckel's diverticulitis is basically a condition in which basically a diverticulitis or an outpouch is present in the small intestine. And when this gets infected, that gives rise to this particular condition of Meckel's diverticulitis. So you'd have to rule that out, particularly on ultrasonographies. Contrast-enhanced ultrasonographies can be carried out, particularly to rule out whether there is some kind of an outpouching that is present in the small intestine or not. Now, the pain which is particularly related to the left upper quadrant, as I've already discussed, we have a lot of patients who would present to you with the myocardial infarction, and the pain would be present in the left upper quadrant or either in the epigastrium. You would come across these patients, and when you particularly carry out the CKMBs and the cardiac enzymes and the EKGs for these patients, you would know down that they have an ST elevation. So that would be suggestive of a lower infarct specifically, lower wall infarct specifically, and particularly the myocardial infarction. And particularly patients of diabetes mellitus, patients who are suffering from diabetes mellitus, they would not be suffering from abdominal pain, but rather they would be giving you the history of indigestion. And that is again suggestive of the fact that you carry out the EKGs for the patient to rule out the MIs in that particular patient if the risk factors are present. Pneumonia is again one of the causative factors, particularly the recurrent pneumonias would be found. And obviously, when you take the history in detail, they're usually pointing out towards all of these factors, and you would be able to just jot down the particular differentials for that particular patient whom you're treating, particularly the age group that you're treating, and particularly the gender. Again, the past history is very suggestive in all of these cases. So it would become very easy for you to rule out a lot of other factors. Then we have the sickle cell anemia. It's again one of the blood dyscrasias that is present particularly in the children. And that would even be presenting to you with the left upper quadrant pain. Lymphomas that are present, and sometimes there are palpable lymphomas that are present. They're basically the benign enlargements of the lymph nodes. So although they are benign, but they're going to be having or the symptomatology of the abdominal pain, a generalized abdominal pain more often. Then we have splenomegaly, or an infection, usually which is basically the Epstein-Barr virus infection, which causes the splenomegaly, is going to also present with the generalized kind of an abdominal pain. Then gastritis, specifically, we can have different causative factors for this particular gastritis. It can be bacterial, it can be viral, it can be even helminthic in its origin, but it would be basically relating to this particular left upper quadrant pain. Now, the left lower quadrant pains would be sometimes related to, again, a diverticulitis, an outpouching that is present. Particularly, there can be a bowel obstruction, which is related to the diverticulitis. Whenever there is a torsion, gastrointestinal torsion, it can usually occur due to sometimes of the abnormal outpouchings that are present at that particular area. So it can be one of the causative factors. We can have patients of ischemic colitis as well. Then we have ulcerative colitis, and all of these are basically the infections or the inflammatory conditions that are basically related to the colon or the large intestine. Urinary calculi or the kidney stones are basically one of the major factors as well. As we said, the lower quadrants are usually related to the pelvic organs. So the suprapubic region is usually associated with a cystitis. Then we can have a prostatitis in the males, particularly urinary retention due to this prostatitis. Whenever there would be a prostate enlargement or whenever there is a prostatitis, there is going to be a backflow of the urine, and that is basically going to cause the urinary retention, particularly in the males. Now, this was all about the localized kind of the pains, particularly in the specific quadrants. Then we have pains which are mostly generalized in their origin, particularly celiac disease. It's again an inborn error, and there is basically some of the receptors are basically absent in the small intestine. And again, there would be a particular history that would be related to these patients. They would complain of the recurrent attacks of diarrhea, acute diarrhea in these patients, and that would be basically a bioborn error present in the patients. Constipation is also one of the factors that can relate to a generalized pain in the individuals. Then we have a chronic diarrheic condition. A lot of patients are basically prone to the development of a chronic diarrhea. So they would be also be basically exhibiting signs of generalized kind of a pain. IBS or inflammatory bowel syndrome is another condition in which there is a generalized kind of a pain that the patient is suffering from. And again, there would be the history of episodes of constipation, which are coupled with episodes of acute diarrhea. So there would be an on and off diarrhea, and sometimes the patient would be suggestive of the fact that he's having constipation. So this would be a particular history that he or she might be having. So we have to basically rule that out, particularly, and it is mostly a diagnosis of ruling out. When you rule out all the other causes, you can sometimes make the diagnosis of an inflammatory bowel syndrome in the individuals. Gastroenteritis, again, bacterial, viral, helminthic, all of these usually give rise to a generalized kind of an abdominal dull aching pain that is present. Then we have mesenteric lymphadenitis that is again present in the patients, and obviously the mesentery is involved. Again, it is a part and parcel of the abdominal cavity, and any kind of an inflammation is going to relate to the kind of an abdominal pain the patient is having. A perforated colon due to any of the causes. It can be a surgical cause as well, and it can even relate to a generalized kind of an abdominal pain. A ruptured aortic aneurysm, as I suggested, that basically we have to rule out the AAA condition. It is the most life-threatening condition in the individuals, and we have to particularly keep an eye on that. So you look out for that, and even if it gets ruptured, it can be a life-threatening condition for the patients. And obviously, lastly, we have to look for any kind of a traumatic condition that the patient might have undergone. For instance, if he had a road traffic accident or any kind of a fall, any kind of a injury with any weapon injuries may even result in a generalized kind of abdominal pain, abdominal trauma. And you have to rule out and obviously take the history in detail for these patients.